Hello everyone.
Welcome to Wise Tips channel. My name is Nobe Yamanaka. I'm a financial planner. This channel is to help people who live in Japan as a foreigner. To start a new life in different country must be very stressful. You have a lot of logistics to do. I hope my videos can help you to understand Japanese systems better. Today, I'd like to talk about healthcare insurance systems. Healthcare insurance systems can help you and your family when you are sick or injured. As I told you in previous video, we are all covered by social insurance systems in Japan. But some benefits are different depending on your social insurance categories. However, I'd like to focus on common benefits for healthcare insurance systems today. Healthcare insurance systems cover some part of your medical expenses. You have a copay amount. Copay percentages are different depending on your age group. If you belong to the group age 6 to 69, your copay percentage is 30%. That means you pay 30% of your medical expenses and 70% of your medical expenses are paid by healthcare insurance. Also, you have a ceiling for out-of-pocket expenses, which means you have an upper limit payment per month. Let me give you an example. If you're hospitalized and your medical expenses are 1 million yen, according to healthcare insurance system, you have to pay 300,000 yen, which is very expensive. However, you have a ceiling for out-of-pocket expenses, which means your final payment will be 87,430 yen, which is called 高額療養制度 in Japanese. If you use a 高額療養制度 more than 4 times a year, your payment will be even lower to 44,400 yen. So thanks to 高額療養制度, you don't have to worry about too much for the medical expenses in Japan. So please remember the word 高額療養制度, which may help you sometime in your future. This table shows you how much user upper limit payment, because 高額療養制度 are different depending on your annual income. I recommend you to bring your healthcare insurance card every time, because if you forgot to bring your healthcare insurance card when you go to the hospital, you have to pay 100% of your medical cost. Of course, you can get a refund if you claim to your insurer, but you have to wait a couple of months to get the refund. I don't think you want to pay more than you have to pay, so please don't forget to bring your healthcare insurance card every time. Also, please note, there are some medical services are not covered by healthcare insurance, which means you have to pay some medical services by 100%. For example, 差額ベッド代 is a typical one. You have to pay for 100% of your cost. If you are hospitalized and you choose a private room instead of shared room with other patients, you have to pay your accommodation fee for yourself. Because your private room is just considered your private cost, then healthcare insurance doesn't cover for you. That sounds very confusing, but don't worry too much. All you have to do is ask the people who work for the hospital. Then they tell you which one is covered and which one is not covered in advance. I have one more information for you. If you have a children, your copay amount for your children is 20%. But some cities provide you subsidy for children's medical expenses. That means you can get a medical service for your children for free. So you'd better to ask your local government office in advance whether they have a subsidy or not. Also, some cities said children means under age of 6, but some cities says children means under age of 15 or even 18. So you'd better to get information in advance. That's all for today. I know medical costs are something you worry about very much. So today's information can reduce your anxiety a little bit. If you like my video, please subscribe my channel. I hope I can see you again. Thank you for watching. Goodbye.